most loving and reverential pranams at the divine lotus feet of our beloved Bhagavan. Prayerfully seek divine permission and blessing for this session. Pray to beloved Bhagavan to be with us, to guide us, to bless us at every step. Revered Dr. Narasimhan sir, revered members of the medical fraternity, Dr. Rammohan Rao sir, All India Coordinator of the medical services, sisters and brothers, loving Sairam to all of you. Swami usually reminds us there are two types of people. One who are practical heroes, and the other group being platform heroes and practical heroes. And who is a practical hero, Swami defines? One who imbibes the values and practices that in the daily life. He is a practical hero. And with Bhagavan's immense grace, we are having Dr. Narasimhan sir today, who not only imbibes the values given by Bhagavan, but practices in every step of the medical profession. On another occasion, Bhagavan said, Seva should be of need and not of convenience. And here we can see our revered Dr. Narasimhan sir, whose passion for the rural health is above words. And in the Medak district, we can see, and even today, sir is the director of the General Hospital and also director of SAI Mobile Hospital, going to each and every village with a good team of doctors and serving the needy. And this message of mobile hospital has been replicated by many states today on behalf of Satya Sai Seva Organization, the South South, and on behalf of all the revered doctors, medical fraternity who are present here. We extend a warm welcome to Dr. Narasimhan sir and request Doctor to address the August gathering. Dr. Narasimhan sir. Jai Sairam. Thank you.
Om Sri Sairam. I offer my humble salutations to the lotus feet of our loving Bhagavan, respected elders, my dear doctors and friends. A very loving Sairam and pranams to you all. I thank Bhagavan on the one hand and the organizers on the other for giving me this opportunity to speak to you all. I shall make this presentation, this talk today, under 4 distinct and specific headings. The topic being Sri Satya Sai Ideal Healthcare. These 4 headings will make the subject clear for all of us. And at the end of the day, we will have a strong take-home message to ponder upon, both for me as the speaker and for you as the listeners, the audience. The first in this list of 4 topics is a prefatory or an introductory note on medicine, our holy profession, health as an important requirement of life, and Swami's healthcare avataric mission. The second would be a portrayal of Bhagavan's magnificent Sri Satya Sai healthcare projects. Not only the glory of it, but more important, what is the message which emanates from it, so that we can take this message down the line into the community. And thirdly, to guide us in this exercise, in this process, the 5 cardinal directives which Swami has given for the medical profession, following which I am sure we will be recipients of Bhagwan's infinite grace, the 5 cardinal directives representing his Abhayhasta. And finally, the most important part of today's discussion or interaction, how do we replicate these models of Swami at our own levels, at the organizational level? Taking the first heading, we all know medicine is the science and art of healing, and hence is a very noble and sacred profession. We deal not with machines or equipments or with computers, but live human beings with pain and suffering, which we, in our humble way, try to relieve. Hence, there cannot be anything nobler than this. And it is for this reason, specific reason, that it is only our profession, we as doctors, are equated with God himself in our scriptures, when our scriptures refers to us as Vaidyo Narayana Hari. And Bhagavan also once told me, Seva cheyalante doctor minchina profession ledu. It all happened this way. Swami first asked me, how many children you have? When I said 2, he said, Pedda Kuturni em cheyalantuno. What do you want to make your elder daughter as? Then, with all sincerity, I said, Swami, me bhakturalaga, as your devotee. Then Swami said, Adi unnadi. Em cheyalantuno. What do you want to make her? Then I said, Bhagwan, whatever you say. Then he said, Doctor Chadipi. Endukante, seva cheyalante doctor ku minchina profession ledu. Swami said, there is no profession higher than the medical profession if you want to do service. This also brings to the fore the importance of health as an important component of the human personality. As you know, the human personality is made up of 3 components: body, mind, and soul. But you'll be surprised to know that all eminent sages and saints, and even God himself, our Bhagwan, have given the highest priority to the body. You'll be surprised to know that Adi Shankaracharya, the greatest exponent of Vedanta, for whom the world was only a creation of the mind, Maya, he said, when he was asked, which is the greatest asset for man, both in his material and spiritual life, he did not say Vairagya, dispassion, Viveka, intellect, Buddhi. No, he said Arogya. And Swami Shivananda, a doctor turned saint, said, I will give admission to only those who have sound and robust health. And Bhagavan himself once told us, Adhyatmikaniki adharamu arogyam. The basis of spirituality itself is health, sound health. Why I am mentioning these 2 things about the holy nature, the sacred nature of our profession, and the importance of health is that it is no wonder that in this yuga, Bhagavan has chosen our profession, healthcare, as his important instrument in his avataric mission. And Swami said, if it was Ramaban in Treta Yuga, if it was Krishna Chakra in Dwapara Yuga, it is Vaidya and Vidya. These are my 2 instruments in this avatar. And we also know Vidya, education, is also an important component of Vaidya, both in terms of our getting first trained as a doctor as medical students, and also even when practicing as a doctor. You all know of our continuing medical education programs. Anyway, with this broad introductory note, which will put the subject in its proper perspective in terms of outlining the sacred nature of our profession, the importance of health, and how we are so fortunate that Bhagavan has chosen our profession, healthcare, as his main instrument in his very avatar, we can proceed to the next heading. But we should remember that if we are fortunate on one hand, the responsibility also is immense on the other hand, to act as ambassadors, silent ambassadors, humble ambassadors of Swami's mission, healthcare mission, taking his message that Vaidya Seva should not be commercialized down the line in the community. Because God has always said, to whom much is given, much will be expected. We now proceed to the second heading, a brief outlining of Swami's healthcare projects, not to really portray the grandeur or the glory of it, because Swami was always insistent that you need not propagate or prachar my nama. You have to prachar my tattva, my theme, my teachings by your exemplary service. But still, we shall see what is the message that emanates from this. We also know that Bhagavan Sri Satya Sai Baba, our Lord, is known the world over for his relentless commitment to gigantic projects in the fields of medicine, education, safety. If you notice, has passed through three distinct phases or stages. In the first phase, way back in 1950s and 60s, Swami said that primary and to some extent secondary healthcare should be provided free of cost to the poor and the needy. And this he did by starting Sri Satya Sai General Hospitals in Puttaparthi and Bangalore. As you know, Swami is one who always exemplifies what he says. And another important point to be noted in this healthcare mission of Swami is Swami has abundantly made it clear on many occasions that he said, I have not come to start hospitals and educational institutes to solve the medical or the other social problems of the society. I have come to remind mankind of its essential divinity. But I will create models which will serve as examples for the community, for the organization, our own Satya Sai Seva organization, for the government, for the healthcare planners to replicate. So in this context, if we take the second phase of the avataric mission in healthcare, which took a giant stride, I should say, when in 1980s, Swami declared that even high quality medical care, tertiary care, what we call, open heart surgeries, complicated neurological procedures, all these should be provided free of cost to the poor and needy. And this was a very loud and clear message because Swami hinted to the governments also that they should not take excuse that they do not have the needed infrastructure in government hospitals to take care of these ailments. And believe me, when the Chief Minister of Andhra Pradesh, Dr. Rajashekar Reddy, met Swami, this is what Swami told him. If you don't have the infrastructure, create a mechanism, create a process, a procedure by which you will address these tertiary ailments. And the Arogya Sri scheme, which came subsequently, was a product of this message of Bhagwan given to the Chief Minister when the AP government now entered into an agreement with an insurance company and started paying them 1,000 rupees for every below poverty line holder and giving these poor people a health card, an Arogya Sri card, by which they could walk even into corporate hospitals for their tertiary ailments. So this is the strong message which emanated from the second phase of the Avtaric mission as far as Sri Sathya Sai healthcare is concerned. But the healthcare mission took, I should say, a quantum leap in 2004 when Bhagavan declared that it is not enough if this high quality care is provided. He said it should be delivered. There is a lot of difference in the meaning of these two words. Providing means the services which are given by a static hospital. Delivery means where the system itself, where the medical profession itself moves to the doorstep, or at least near the doorstep of these poor, unfortunate people living in villages, and provides a quality care. This Swami did by launching the well-known now Sri Sathya Sai Mobile Hospital in the year 2006. And this opened literally the floodgates of quality rural outreach healthcare. But the monolithic giant-sized hospitals of Swami, the super specialty hospitals, are known the world over. But still, if not to a great extent, to some extent, the glory of this rural outreach service, which is the most appropriate one for a country like India, is still not well known, even among our own medical professionals. And hence, I would dedicate some time to portray this beautiful project of Swami. There are 9 cardinal or important features of this beautiful hospital. Swami declared, if my devotee is in pain, na bhaktudu kashtamlo unte nene veltanu. If my devotee is in pain, I will myself go. I will not wait for him to come. And then he said, Anduke doctorlu meeru kuda Vaidyo Narayana Hari, you are embodiments of Lord Narayana. You should yourself reach out to these poor suffering people in the villages and not wait by sitting in towns in hospitals. So the 9 cardinal features of this hospital is, firstly, the mobile hospital was started even though there is a general hospital, a super specialty hospital in the town of Puttaparthi. Secondly, the beauty of it is manned by voluntary doctors. I will take up each of these points with an important message which comes out of it so that the organization or our doctors at other ends can also replicate this, which they have started doing. The third important aspect of this hospital is there is regularity and fixity. It's a sustained service. Can you believe it is now 18 years old, even 13 years after the Mahasamadhi, the physical moving away of our Bhagwan. Fourth, being a highly technical service, a very professional approach has been adopted in this by a scientific study of community ailments. And once this is done, the 4 Ds, which I would call, which are required for quality care in any setup, especially in an outreach setup, where you have reached out to them, all these 4 Ds are there: doctors, diagnostics, drugs, and a sound delivery system, most important. And in this process, technology has been used so that we have 12 different portable equipments to support the doctors. And again, as you know, there will be ailments which cannot be dealt with on the field. They require a follow-up care. IT support is taken in this, both for data management and ensuring a quality follow-up care. The next highlighting feature is, it's a very holistic or a comprehensive integrated approach with a fine blend of both curative and preventive services. And when all these ingredients are incorporated into the kit, it becomes a fertile field for both academics and research, which is happening now. The end point being a high degree of patient satisfaction, which again is important, as we shall see. So the first highlighting feature, as I said, is notwithstanding the fact that there is a general hospital, a super specialty hospital, Bhagwan started this. And we all know, even when some of the people raise their eyebrows, why at all one more hospital? We all know that 70% of our population still is in villages, but unfortunately, see the paradox, 90 to 95% of all medical facilities, infrastructure, doctors, diagnostics are all concentrated in towns and cities. And unfortunately, even the governmental three-tier system of healthcare, primary healthcare centers for the villages, the 70% of the population is given rudimentary healthcare in the form of primary health centers, secondary care being provided by district hospitals, tertiary care being provided by medical colleges in towns and cities, I would say more to the elite. So there is no wonder in the fact that Bhagwan felt the need to start an outreach service, even though these two hospitals existed. And to me, he quoted four main reasons outlining patients' constraints. First thing he said, వాళ్ళు పాపం కూలి చేసి బతుకుతారు. They work on day basis. And if they give up one day's work, that would mean they have to compromise with even a square for that day. And there are senior citizens in homes, in villages, in dwellings, for whom there's nobody to bring them to the hospitals in towns and cities. And then he said women have to do a dual work, both at home and in the field. And finally, he said there's a huge lack of awareness, which we literally saw with our eyes, and we see even now, in spite of all the advancement in mass communication, computers, all that, whatever you call technology and all, there is so much of ignorance on important aspects of health and disease. And so the message is loud and clear to we as Satya Sai doctors, to we as members of Sri Satya Sai Seva organization, that the priority in our agenda of work in medical care has to be outreach care, the example which Bhagwan has set up to us. And secondly, this program is manned totally by voluntary personnel. We have 250 to 300 doctors who come at different times and according to their convenience. And on any particular day, there are 15 doctors belonging to 10 or 12 different specialties. And again, there is an important message which comes out of this. This is happening and this is increasing now. Even today, we have a professor of medicine, Dr. Ramanamurthy, on the field today with 3 of his postgraduate students. The message is that I have noticed there is an inborn urge in every doctor to pay back something to the community, which has trained him, which has nourished him, which has nurtured him. It is for the organization. Of course, doctors also have a responsibility to create the right platforms, to create the right outlets for doctors to find expression to this in them, to pay back something to the community in the form of their technical expertise. And in this connection, I have been working with the Satya Sai Seva organization, starting from the national president, and we have now devised a 3-tier pattern of medical seva, taking Andhra Pradesh as the pilot state, which is now in the process of going to get implemented in the next couple of months. The third highlighting feature is any medical service, for that matter, especially an outreach service, should not be in the form of sporadic or occasional medical camps. Because Swami once said, ఈ క్యాంపులు చేసి మీరు గ్రామ దర్శనం చేస్తున్నారు, గ్రామ సేవ కాదు. It has to be a regular, serious and a sustained service. This is an important hallmark of the Satya Sai Mobile Hospital. As I said, it has been functioning from the last 18 years, from 1st to 12th of every month. Even today being a Sunday, it was not a holiday for us, it was a holy day for us. I was in the village with a team of 15 doctors till 4 p.m. in the evening. The important message which comes out of this is, it is only with such sustained service that quality care can be rendered. Because as you all know as doctors, follow-up is an important component of good medical care. And this can be ensured only if we are regular in our service. Not only that, it infuses faith and confidence in the minds and hearts of the people whom you are serving. And it brings credibility to our service. The next highlighting feature is, as I said, it's a technical service. So based on our experience on the field and knowledge of public health, we decided to classify ailments belonging to any specialty, to any organ system, into 6 categories: common, chronic, intractable, asymptomatic, preventable. And medical emergencies, which of course cannot be handled by an outreach service except for first aid. But the benchmark of a quality outreach service, any mobile hospital which is started anywhere, is we should see whether it is able to address the first 5 categories of this 6 categories of ailments. And unfortunately, many of these outreach services address only the common ailments. And as I said, they are sporadic or episodic in nature. Once you have this classification, then you will develop a good operative strategy. This is the ideology, and this will dictate the methodology. In fact, it is said that all successful methodologies have a strong ideology. And my revered, respected Dr. Ashwini Kumar, who is like a Bhishma to the entire medical fraternity in Andhra Pradesh, says this classification is not found in any public health book. It has come out of our heart. And this is really the type of classification. Say, for example, you take the specialty of ENT. A common ailment is a common cold. A chronic ailment is a CSOM or a chronic maxillary sinusitis. An intractable ailment is vertigo, which can be central in origin from the brainstem, or it can be peripheral from the labyrinth. An asymptomatic ailment can be, when we did the school health service on doing audiometry, we found 4% of school children have hearing impairment sufficient to interfere with their academic performance. A preventable ailment is one. Like, for example, you take proper care, early treatment of CSOM, you would prevent hearing impairment. So any organ system, any specialty, if you have this classification, then to each of the categories, you will allocate ailments and then develop the appropriate strategy. And as I said, the 4 important Ds for quality medical service, not only rural outreach service, are doctors, diagnostics, drugs, and delivery system. Doctors, we have already mentioned how a multi-speciality approach, good or bad, modern medicine is all about specialization. But the hallmark, the master stroke of our master was when he declared that if you doctors go all the way to an outreach setting, and then there you write a prescription and tell the patient to get an X-ray done in some town, like for example here in Dharmavaram and Anantapur, he said it defeats the very purpose for which you have gone. You have gone inside and now you're chasing them outside. So he gave us that beautiful bus, which has both for imaging and for labs, and now we have incorporated even the ophthalmology room in it. So we have used technology to its fullest extent. And I'm so glad to tell you that now technology has enabled sleek, portable, compact equipments, lot of equipments, except say, for example, CT scan or MRI scan, most of the, and now we are having a handheld instrument for monitoring the prothrombin time, the INR, as you know, anticoagulant therapy is very vital for valve replacement. Even government does it, but it doesn't have a mechanism. It spends about 2 or 3 lakhs, but then there's no mechanism to ensure that the valve doesn't get stuck. And now we have an instrument which has been given to us by a doctor, and our pathologist, Dr. Nandini, in the super specialty hospital, is comparing it with the standard way of testing PTINR, and she'll be able to tell us whether we can use it. So anyway, both for imaging and for labs, as you all know, cell counter, semi-auto analyzer, electrolytes machines, so many are available, and we have used technology to the fullest extent possible. But then, as you know, the end point of good medical care is the provision of medicines. And here again, Bhagavan declared, having gone all the way, done all the tests, taking good doctors, if you just give a prescription, it's a waste. Because these poor patients cannot buy the medicine. And I'm so glad to say that in the outreach service of ours, we have a strong formulary. And for patients with chronic ailments, we give them 1 month medicine till we reach out the next month. And as you know, these lifestyle diseases account for 60%, as we shall see, of any hospital attendance or any attendance in an outreach service or any hospital. And therein lies the importance of uninterrupted use of medicines. Drug compliance, we know, is critical in ensuring that target organ complications don't happen. And as I said, 10% of ailments in outreach setting require higher diagnostics, medical management, or even surgical interventions. And I'm so glad to tell you that in this respect, we have the support of IT, from 2013. It helps us in data management and follow-up care. And this follow-up Medicare, again, the most important message which emanates out of this is that it ensures integration of primary, secondary, and tertiary care. This is something unheard of. In Kakinada, when I made this presentation in IMA, they were all wonderstruck because, as you know, these three levels of treatment are devised by us, are given, the definition is given by us, and they are provided in watertight compartments. Even in government, a patient goes to a primary health center with a lump in the breast, he says, go to a tertiary center in a city. There is no guided pathway. The patient is not escorted, and often he loses his way or he doesn't go at all. But here, as I said, primary and to a great extent, secondary care is provided on the field, and for ailments requiring follow-up care, they are provided in our base hospitals in Puttaparthi, the general hospital. Today also we had, for example, oncosurgeries, and day after tomorrow we are going to have laparoscopic cholecystectomies being done by Dr. Prasad, an eminent surgical gastroenterologist from Vijayawada. So what I mean to say is that, again, there is a very strong message for the organization, for healthcare planners, that if they have to integrate these three levels of care, a quality outreach care like the SSSI Mobile Hospital is the example which has to be taken for replication. The flow chart of service at SSSI Mobile Hospital, as you can see, patients arrive, and first we use the opportunity to have a good health education session because they are drawn from so many villages. They will hear you with rapt attention because you are also going to treat them. And from there, they get registered, go to the doctors, then the diagnostics, and then the medicine. It's a beautiful flow chart, about 500 patients, 600 patients with their attendants, 1,200 people. There is no confusion or chaos. They are literally escorted and a quality care is rendered. These are some pictures of doctors in service. The next important hallmark of this outreach service, why I'm taking a little more time in portraying this service is, as I said, the monolithic hospitals, the super specialty hospitals are known to the world, but even to our medical fraternity, even to our own organization members, many of them, they do not know the depths, the width of this outreach service. And as I say, the approach is holistic. It is a fine combination of curative and preventive services. We call it a curative drive and preventive focus. Both are joined together, and one complementing and supplementing the other. The base is spirituality in the broadest sense, as told by Bhagwan, which impacts, as you know, the mental health, which is now considered equally important as physical or bodily health. And there are, again, two important messages which emanate from this. The first thing is that this preventive service, which is done at the individual, family, and the community level, a very scientific, a standard public health approach, has to be done on a sustained basis for it to produce results. For example, we have so many villages, Rachuvarpalli, Lingapagaripalli. These villages did not have a single sanitary toilet when we went, and now it is 100%. Secondly, the important message is all the exercise which is done, unfortunately in government, it is done, as I said, in isolation, in tangentially different directions. They are not integrated together. If health education has to have meaning, has to have receptivity, the people should imbibe your teachings, then it should be integrated with good curative care. Then only your health education. There is a stage of awareness, there's a stage of acceptance, and then comes the stage of implementation. These things I have literally seen with my eyes. And once when I told Bhagwan, Swami, health education, kastabadi chestunamu, kani, but I said, then Swami immediately understood that I'm going to say, but I don't know whether it's having impact. Swami said, no, but. And he said in English, you should do, you should do, you should do. Meer mee sadhana laga cheyanడి. ఫలితాలు వెంటనే రావు. అలవాట్లు మార్చాలంటే టైం పడుతుంది. Do it as your sadhana. It has to be relentless. It has to be sustained. It has to be committed. And moreover, as I said, it has to be integrated with good curative care. And in this process, the spiritual dimension of health, if we as Satyasai doctors, we don't carry this message, then really the society is at a loss, because there are no other doctors who can talk of this. And we are doctors who try to at least lead the life which Bhagavan has told us. In fact, ancient India, if you see all our doctors, let it be Sushruta, Charaka or Dhanvantari, they were saints and sages. And hence, when it say spirituality, it doesn't pertain to any cult or religion or practice or a leader. No, it refers to the broad spiritual practices, the age-old spiritual practices of prayer and meditation, the writing of God's name, Likita Japa, as we call it. And we doctors, Swami once asked Bangalore doctors who had come to him, ఎంతమంది మీలో మందులు వాడేటప్పుడు పేషెంట్లని దైవనామం తీసుకొని వాడాలని చెప్తున్నారు, he asked. And when there was no reply, Swami said, your service is a waste. So please remember that the spiritual dimension of health, we have to be clear and we have to be bold and we have to practice at least in a humble way in our own lives. Then only we can really talk about this. And in this context, again, the message is clear that now NIMHANS, the National Institute of Mental Health, is clearly shown by its studies that it is our thoughts which really impacts the function of hypothalamus, the most important endocrine organ. And if hypothalamic function is deranged, it gets reflected in impaired function of the pituitary and the adrenal. Steroids production, steroids levels rise. And as you know, steroids are immunosuppressive in nature, and it becomes a trigger for cancer. Because Swami once, when Dr. Mohan Vamshi, an eminent oncosurgeon of Hyderabad, in one interview asked, Swami, Andhra Rashtralo cancer vyadi ekkuvaipindi. Then Swami said, Daniki kuda hari, vari, kari. And looking at me, he said, Gramallo kuda ippudu ee daiva namamu, daiva preeti, faith in God, sanganiti, societal discipline, societal values, and papa bhiti, fear of sin, fear of doing wrong, is disappearing. Eppudu hari, 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 vari, vari, vari. Anduke cancer vyadi kuda ekkuvaipindi. So, as I said, the approach in the mobile hospital is very holistic and comprehensive. And as I said, the message is loud and strong for the organization also, that they have to have this integrated approach. And as I said, it will have meaning only if the curative care is strong, which is ensured by incorporating the ingredients which I outlined before. And as I said, when you have this sort of an arrangement made, it becomes a fertile field for clinical material. Again, the message is loud and clear for the government here, that medical students, if they want to know about rural health disease spectrum, disease community, disease load, then they really need to have a quality service in the periphery, not the rudimentary peripheral health centers where they need to get exposed and where they need to get trained. And in this respect, the government also, the message is clear that rural health service should not be imposed after they finish their postgraduate. Because after all, they'll have a mission to further their studies by doing doctorate or start their own practice. If it gets integrated during their training period itself, by putting them, drafting them into mobile hospitals, which we have made a very beautiful proposal to the government of India. And I was recently called by the highest officials in the health department to make a presentation. And when I made this point that postgraduates should be drafted into the mobile hospitals, and we have made excellent calculation as to how many mobile hospitals are required for a taluk, a district, a state, for the country, they were amazed when we gave the solution to the eternal problem for the government in terms of human resources, when we said that if you can't find doctors, please draft second and third year postgraduate students into the mobile hospitals, and thereby they get rural service exposure. The mandatory rural service which you are talking about also gets fulfilled. That is the beauty of Swami's project. There is a message. Bhagavan clearly said, I have come to create models, and it is for the society, the government, healthcare planners, and even our own organization to replicate these models. And as I said, the end point of this good service will be patient satisfaction. I'm so glad to say there is a research project being taken by our own Sri Sathya Sai University Institute of Higher Learning in association with the Indian Statistical Institute. They have completed the preliminary studies. They have 15 parameters to assess patient satisfaction. I'm so glad to tell you it is 94.6% for the Sathya Sai Mobile Hospital. And again, why I am so particular, not to trumpet our glory, but to bring out an important point in this, that if the patient satisfaction is high, then only the larger values for which Swami has started these services, the healthcare service especially, in terms of percolation of human values of Satya, Dharma, Shanti, Prema, and Ahimsa down the line in the community, it can get percolated only if patients who come to our hospitals, especially our outreach care, if they are fully satisfied, then they'll be prepared. As Swami said, ఇప్పుడు కూడా ఆ భక్తి ఇంతో అంతో మిగిలిందంటే గ్రామాల్లోనే మిగిలింది. Only in villages, even now, the ancient Indian culture is present to some extent. And there is danger of it getting wiped out because modern influences, the infiltration of television, computers, cell phones. And hence, Swami said, మీ ఆదర్శమైన సేవతో విత్ యువర్ ఎగ్జాంపులరీ సర్వీస్ వాళ్ళ మనసులో నమ్మకం కలిగించి మన సాంప్రదాయము, మన యొక్క సంస్కృతి, అవర్ ఏన్షియంట్ ఆధ్యాత్మికాన్ని మీరు పునరుద్ధరణ చేయాలి. అందుకే స్వామి సెడ్ గ్రామ సేవ ఇస్ రామ సేవ. ఇఫ్ ఇట్ Rama Seva was not for searching out Mother Sita only, it was for re-establishment of Sanatana Dharma. In this way, Grama Seva also is not only for provision of medical care, but to ensure Swami's the human values which Bhagavan has outlined, Satya, Dharma, Shanti, Prema, and Ahimsa, they get percolated down the line, and there is re-establishment of Sanatana Dharma. So with this sort of a portrayal of this outreach service, which I took time, because as I said, India is a land of villages. 70% of our population is still in villages. 90 to 95% of healthcare facilities are centered in towns and cities, even governmental ones. And hence, we as the organization, we have to be the torch bearers in this mission of Bhagavan. And that is why Swami has started it, so that this model would be replicated both by the SAI organization and also by the government. We shall now proceed to the third heading of today, the 5 cardinal directives of Swami for the medical profession. And these directives, these values are eternal. It applies to every age whenever the medical profession is taking care, wherever the medical profession is taking care of the health of people. The first is how Swami has outlined health itself, not disease, health itself. He once asked us in an interview, health ante emi, how will you define health? And when we told him the standard WHO definition of health, Swami stopped us in between and said, kaadu nen chepta. And I think that was the best definition which Swami had given on health, which I have told in many platforms. And he said, he started with saying, ఆధ్యాత్మికానికి ఆధారము ఆరోగ్యం. Health is the basis of even spirituality. And ఈ ఆరోగ్యము 5 విషయాలపైన ఆధారపడి, it is dependent on 5 factors. He said, ahara, food; vihara, physical exercise; achara, our conduct; uchara, the way we speak. We all know of these lifestyle diseases, how these ego clashes in offices lead to even heart attacks among the higher echelons in the both governmental and private service. And finally, vichara, or thoughts. And then Swami said, the first and the last, food, ahara, and vichara, these are the most important. And you all know, my dear doctor friends, that medical profession has now concluded. Our lifestyle specialist, Dr. Menon in our hospital, will tell us that modern medicine now says that these 2 healths are critical to really say if an individual is healthy: metabolic health, which is represented by ahara, and mental health, which is represented by vichara. And when we come to the last point of replication, I should spend a couple of minutes on this metabolic health aspect, which is very important, very crucial now. The next important subject on which Swami has given clear-cut guideline which needs to be followed is regarding specialization. As I said, we are in the age of specialization. We agree, we accept it, but then we have gone into super specialization, super specialization. I'm so amazed to know, my daughter is now doing a residency in neurology, that in neurology, again, there is subspecialization into what is called epilepsy, headache. For headache, somebody spends 2 years or 3 years. There is movement disorders. We are knowing more and more of lesser and lesser things. And in fact, in the conference, cardiology conference, Swami said, మీరు డాక్టర్లు, మీరు కార్డియాలజిస్టులు, కొంతమంది రైట్ హార్ట్ స్పెషలిస్ట్, లెఫ్ట్ హార్ట్ స్పెషలిస్ట్, బాటమ్ హార్ట్ స్పెషలిస్ట్ అని అయిపోయారు. మీరందరూ కలిసి, all of you successfully have broken the human heart. He said, I don't want these doctors. I want వైద్యుడు, physician, an integrated doctor. జబ్బు ఏమని చెప్పగలగాలి. He should be able to tell what is the problem. మీరు కార్డియాలజిస్ట్ చూసి రాస్తారు నిల్ కార్డియాక్. ఏం నిల్లు? ఇక్కడ నిల్లు he said. You have to tell what is the problem. You may not be able to treat it. And that is where I emphasize that we as SSI doctors, we may be even super specialists, we may be cardiologists, neurologists, but please retain the flavor of a physician or a basic surgeon. And in this respect, I've hit upon a very good idea where we doctors of different specialties, like the mobile hospital, we have doctors of 15 to 18 specialties. We can have WhatsApp group where every doctor will pitch in with 1 or 2 lines. Like, for example, a cardiologist will write the most useful or the best oil which can be used for cooking is the importance of olive oil, the importance of flaxseed oil, which gives us omega-3 fatty acids. A pharmacology specialist, a professor of pharmacology, we have in fact one in our group, can write that 5 mg of rosuvastatin is equal to 10 mg of atorvastatin. 2.5 mg of ramipril is equal to 5 mg of enalapril. Many of our doctors even don't know. I'm sorry to say that if one of our specialist doctors' child falls ill with a hyperpyrexia, high-grade fever, most of us do not know that on the first day itself, we have a very simple test to diagnose dengue that is called NS1 antigen. In fact, we empirically prescribe antibiotics like clavulanic acid or cefixime. So this sort of an integrated approach, Swami was very insistent, and this is especially relevant at a time when we are going into too much of super specialization. The next important aspect which Swami has told us as doctors is the role of commerce in medicine. Unfortunately, a noble profession like medicine, commerce has invaded it. And gone are the days when we used to have nursing homes. The word itself is so soothing, nursing homes. And now we have corporate hospitals manned by businessmen. And in this respect, as I often say, Swami very humorously told in one interview, Manishi gunde ela kottukuntundi, how does the human heart beat? And then when we said love, Swami said, na baga telsu. Labhamu dabbu, profit, money. This is how your hearts are beating. And then Swami said, when you yourself are embodiments of Lord Narayana, Vaidyo Narayana Hari, will your consort Lakshmi be far away from you? She will follow you wherever you go. So you need not make too much of a conscious effort to make money. But again, Swami clarified, నేను డాక్టర్లను ఎప్పుడు డబ్బు సంపాదించొద్దని నేను చెప్పలేదు. I did not say doctors should not make money or earn money. ధార్మికంగా సంపాదించాలి. He said, just as any profession, all the more it is important because it is the art, the science of healing somebody who is sick, and you should not exploit that situation in that individual to make money. Follow dharma. This is the loud and clear message of Bhagwan. And he said, మీకు ఒక స్పెషల్ స్కిల్ ఉంది కాబట్టి, బికాస్ యు ఆర్ ఎండౌడ్ విత్ అ స్పెషల్ స్కిల్, వారానికి 2 గంటలైనా కానీ సమాజ సేవకి, సొసైటల్ సర్వీస్ కి కేటాయించేది. దిస్ ఇస్ ద మెసేజ్ ఆఫ్ భగవాన్ యాజ్ ఫార్ యాజ్ మనీ మేకింగ్ ఇస్ కన్సర్న్. దో హీ స్టార్టెడ్ హాస్పిటల్స్, దో ది సత్యసాయి సెంట్రల్ ట్రస్ట్, ది సత్యసాయి సేవా ఆర్గనైజేషన్ run projects are free, it doesn't mean doctors should do only charity. It's not possible. They have their own lives, their own family. But Swami said, practice dharma in your profession. Most important it is. And at the same time, once a week or once a while, you dedicate your time for societal service. And this is the most important aspect of Swami's teaching. Love, the essence of Medicare. The theme, the everything of true Medicare is loving service. And Swami has told so many times on this. When I told Swami in one interview, Swami, mobile hospital seva, Shraddhato, Bhaktito, I was telling him with commitment, devotion I'm doing, Swami stopped me. I was about to tell, but Swami wanted it to be first. Premato. At that time, Bhagwan's voice was not coming out, but it exploded out. It means he had laid so much emphasis on it. Premato chestunanani cheppu. And it seems he once said that మీరు ప్రేమతో సేవ చేస్తే, డాక్టర్సే కాదు, everybody in the medical profession, right from the registration people In our hospital, I again and again emphasize, you're the front office, you're the face of the Satya Sai medical care. Be loving in your approach. Greet the patients with folded hands. Thank the patients for giving you the opportunity to serve. And Swami said, if you do medical seva with love, 60% of the ailment goes away. The remaining 40%, if you do a good technical work, my grace descends and it becomes 100%. And as I often repeat, Swami once said, if you practice medicine with love, it is Medicare. And that is why Swami said, all my institutions have this sort of an architecture. You are taking the patient in a loving embrace. But if you practice medicine without love, it is medicine. SIN, Mahapapamu said. So love has to be, and Swami once so beautifully told in an interview, this love, don't think just because you're doing some free service or service in Satya Sai hospital or Satya Sai medical camp, that itself is love. No. Swami said the love has to effuse out. It has to exude out. It has to be expressed. If a mother loves a child, she will lift the child, she'll feed the child, she'll fondle the child, she'll kiss the child, she'll make the child sleep. It has to be a loving embrace, a loving care. Swami said, greet the patients with folded hands. Hold them with your hand. Hold them with your chin. Congratulate them if the reports are normal. And in the end, silently thank them for giving you an opportunity to serve. I still remember in the Gram Seva service, my friend Mr. Bhaskar Rao, who I consider myself to be his right hand. He says I'm his right hand. But we all used to do surgeries for village patients. Even now, sir does a very big work of follow-up medical care. And what we used to do after anesthesia has been given, the patient is unconscious, we touch his feet. We really, thank him for giving us the opportunity to do the surgery. Because if he's conscious, he may not allow us to touch his feet. Anyway, love has to be the essence of Medicare. Otherwise, it is not Medicare. As Swami said, it may even be medicine. So the fourth heading now for us, the most important is, how are we going to replicate Swami's models? As I said, we cannot lift our collars and say, we are the fortunate ones. The healthcare mission, the medical profession has been selected by Swami as the main instrument in his avataric mission. That is why he used to make us doctors sit in the veranda. But along with this fortune, as I said, goes a big responsibility. How are we going to now replicate these models of Swami? As you know, this can be done at the individual level and at the community level. And at the individual level, to start with, excuse me for a minute. At the individual level, wherever we are serving, especially if we are serving in government hospitals or in where there are many poor patients, especially, we should be model Sai doctors. We should be exemplary Sai doctors. And Swami once said, Na nama nitiskotu, don't take my name. Me adarshamaina sevato, valle adadali. They should themselves ask. It may be the management or it may be the patients who will say, Evaritanu ఇంత చక్కగా సేవ చేస్తున్నాడు, ఇంత డివోషన్ తో చేస్తున్నాడు. Then it seems after some time they will say, ఈ డాక్టరు సత్యసాయి భక్తుడు. He has been inspired by Bhagavan Sri Satya Sai Baba. This has to be the example, the model which we should provide. We may not be doing service in Satya Sai hospital. In fact, Swami once told Dr. Gayatri, a gynecologist, when she said, Swami, me hospital seva chestanu, I want to serve in your hospital. Swami said, Anni hospital naave kada, ekkadaina adarshanga meer seva cheste, nenu akkada untanu. So this is the example which we have to give, especially we doctors. And as I said, our practice should be wholesome, dharmic in nature. We should not resort to any form of practice which would be equivalent to exploiting these sick individuals who have come to us. And not only that, all of us, we as Sai doctors, whether we are in clinics or in hospitals, we can devote one day a month. It may be our own birthday. It may be the birthday of our partner, of our child or our grandchild. That day, we would treat the patients free. And as in Chennai, I know, one bed in every hospital, private hospitals, they can earmark it for these poor patients. So each one of us, and I know of so many doctors who are already doing this. I can take the names of Dr. Surender, whom I call Surrender, in Siddipet for years together. He has been doing the last week, not just a free medical camp, but a free service for all patients with deformities, especially polio or whatever be the cause. Free surgery. He has done hundreds of surgeries. And one doctor from Kerala, Dr. Ajay, it seems, he saw me on the 30th when I go to keep the list of doctors at Bhagwan's Samadhi for blessings. He said, "Sir, I am waiting for your darshan." I said, "No." When he told about him, I said, "Maybe you waited for my darshan. I am waiting for your sparshan." Such a noble doctor you are. He said that he and his wife look literally upon every patient as Swami himself, it seems, and he treats them accordingly. We also have other examples like Dr. Sai Prasad in Machilipatnam, Dr. Faninder, Dr. Rambabu. So many doctors are there. But on this particular day, when our Mukundan sir has taken so much pains, so innovatively has arranged this meet of all our South India doctors, let us take a small pledge in front of our Bhagwan that we will earmark one day a month for free service. If we are especially in the private setup, our clinic, let it be, our hospital, let it be, that would really be a tribute to our master and whose centenary celebrations we are going to have. Because if we want to make Swami happy, it is not going to be with all these celebrations, with all these Patyatras. No. When we really take up his message, and as doctors, we take the message of Bhagwan down the line in the community by our exemplary service, that would be the day when Swami would be really happy. And in fact, as far as the mobile hospital is concerned, I am so glad to tell you that Swami, it seems told, I was not there, it seems told, na tallikichina pramanam, the promise which I gave to my mother has been fulfilled by this mobile hospital. So anyway, now more important is replication at the community level, because Swami always liked combined sadhana. Let it be bhajan, let it be seva. And as you know, he always used to say one finger each is not really strong, but if the whole hand combines, how strong it becomes. So we have to see how we will replicate this at the community level. And in this context, dear doctors, I would request you to kindly associate, if possible, only with Sri Satya Sai Seva organization. This is the only organization which has been founded by God himself. And he gave it the suffix Seva, outlining the importance of selfless service. And it is the purest form of Bhagwan's expression of Seva, the Satya Sai Seva organization. Even now, the principles which Bhagwan had enunciated is being followed by this, and it would give you the right platform. And at the community level, if we have static services, we can have clinics which are there in many towns, but I would humbly request that these clinics should be stepped up to a very high quality. They should be specialty clinics. It could be a single specialty, uni-specialty, or a bi-specialty, two specialty, or it could be even disease-specific, an epilepsy clinic, for example, a chronic disease lifestyle clinic, for example. What I mean to say is your width of service may not be big, but your depth of service should be more. That is, you should be able to address, as I had outlined, all the 5 categories of community ailments, so that at the end of the day, there is a very high patient satisfaction, and thereby the message of Bhagwan gets percolated down the line in the community, and your satisfaction, your evolution, spiritual evolution will also be great. But most important are these last 2 points, which I would say mobile health services. I need not again and again emphasize the importance of this and how Bhagwan himself has shown us the way. We may not be able to replicate Bhagwan's super specialty hospital. It is very difficult, as you know, but this mobile health service, which goes into the community, it doesn't enter, it penetrates into the community, it enters into their lifestyle, their habits, their spiritual outlook, all that. This model has to be replicated. And as I said, Puttaparthi model is a multi-specialty model. It is the absolute model. It everywhere and elsewhere, it need not be in that way. It can be a uni or a bi-speciality. It could be a Satyasai rural chronic diseases service, a Satyasai rural ENT service, a Satyasai rural dermatology and psychiatry service, so that it doesn't require that big, sort of a specialty diagnostic bus costing 1 crore or so. We can still do a quality service. And in this context, I'll give you examples of that also. And yeah, these are, yes, one important uni specialty service, which I would outline, which Bhagwan was very fond. And when I showed him the book on this day, on this service, on Shivaratri next day, Swami called me suddenly when I was sitting in the veranda. He saw this book and then materialized a Ganesha Vigraha and gave it to me. And then when I said, Swami, Desha Vyaptanga iti Chiragali, this should happen throughout the country. Then Swami said, Tappaka Jayamu, 2 words he said. Definitely success. So the onus is now on us. The Satyasai organization, Satyasai doctors. This is a beautiful uni-specialty service, not at all difficult. As you can see, I have outlined the points. It's an intense need-based service. It targets the children who are the priority section. Children, women, senior citizens, as you know, Bhagwan always says they are the priority sector. And a school is an organized sector where all these children are available. It is easy for you to do. In a random community, you'll find it difficult. And as you know, asymptomatic ailments are high in children. And for some unknown reasons, children don't tell their problems. We have one patient, I forget her name, she had a double valve chronic rheumatic heart disease. Still, we had to check her and then bring out that problem and solve her problem. Again, parents, especially in villages, are ignorant, sometimes indifferent. And this beautiful service, I mentioned to Bhagwan also, it outlines what I would say the 3 healths: the health, habits, and home environment of the children. Beautiful data is also generated, data which would be immensely useful to the government. And in the mobile hospital service, we do once a year the school health service. And when we compare it with the previous years, there's so much of improvement as far as the habits especially is concerned, in terms of children using toothbrush and paste, paring their nails, wearing footwear, so many aspects. And we use a standard format for this, where we really have first a checkup done by a general physician. Organizations, in fact, we have spelled out this as an important component of the 3-tier pattern of what we are now calling Sri Satyasai Ideal Healthcare for Sri Satyasai Seva organization. The Samiti, 6 Samitis in every district will do the school health service. The first, it will be about, as you can see, about 10 or 12 visits. And the first 4 visits is done by a general physician who makes a good checkup of all aspects like height, weight, all these things. Paramedics, not many are required, 7 or 8 are required. And then 1 or 2 visits of dental, ENT, and ophthalmology doctors. And at the end, a master proforma, a master data is generated, and all intricate problems, like as I said, follow-up services for needy children. Let it be a cardiac ailment, let it be CSOM, let it be an eye problem like a keratoconus or a refractive error. All these we should be able to attend. And in this respect, we are going to create a central supporting unit, CSU, for every 6 districts, which will be made up of 5 doctors and the organizational heads. Online information will be given about difficult, intricate cases. And then this group will decide how to tackle, how to address, how to provide end-to-end solution for such problems. And on the sidelines of the health checkup, there will be also health education. Bal Vikas teachers, Vidya and Vaidya, the 2 wings of the Satyasai organization, can get blended in this process. They would be teaching not only on aspects of health, we are going to make standard health education material also for this, but they would be teaching them moral values, not so much our traditional Bal Vikas, but a slightly modified form of Bal Vikas, where the emphasis is more on Bal Vikas, and to take the teachers also in a loving embrace, to gain their confidence and to see that they continue this exercise of health education. We also have a master health checkup for the school teachers, and we also distribute hygiene kits at the end of the 12-week service. Excellent, as I said, useful data is generated. And as I said, this service is very dear to Swami Vat. So when we want to replicate Bhagwan's message, the outreach rural healthcare, which I had outlined, need not be of the form in which we see in Puttaparthi, a multi-specialty. It is really a very difficult one. It is both Bhagwan's grace, our hard work, the commitment of our doctors, that even after the physical passing away of Bhagwan, the Mahasamaj, still it is going on. But then the organization in the periphery can start this uni or bi-specialty services in the form of school health service, or I said, in Hyderabad, our friend Dr. Rambabu is associated with an organization called SAI, Society Against Hearing Impairment. And do you know, they do only ENT service. And believe me, I'm told in that district, the whole of, the load, the pending cases of CSOM have got wiped out. Even cochlear implants, they arrange. Sky is not the limit for our organization. There are so well-meaning people, wealthy people who are prepared to support all our efforts. If only we really start off, the organization creates the right platform. It can be Sri Satya Sai Rural Dermatology Psychiatry Services. These are two specialties which don't require much of diagnostics or no diagnostics at all. At the most, a magnifying lens or punch biopsy forceps, these are only required. Psychiatry is so much of a requirement, especially in villages. The morbidity due to psychiatric ailments, dermatological problems is so high that would be really a worthwhile uni-specialty service if we start. It could be a Satya Sai Rural Chronic Diseases Service, as we shall now come to the last component of our discussion today, wherein we are talking about how we are going to replicate Bhagwan's model in this aspect. As I said, Swami's emphasis was equally or perhaps more on education or prevention. And in this context, we really need to create in ourselves a huge awareness about they are not lifestyle diseases, they are life-threatening diseases, they are life-killer diseases. 60 to 70% of outpatient or inpatient admission attendance in any hospital, even in our own Satya Sai General Hospital, for which also I am the head, belong to these 7 categories of ailments: diabetes mellitus, hypertension, stroke, heart disease, neurodegenerative diseases, autoimmune diseases, and cancer. And there was a time when, as you know, the society was gripped by infectious diseases like cholera, chickenpox, smallpox. At that time, scientists, doctors, biosciences heads, they all sat together, and then came about the germ theory and the immunity theory, and by which came sanitation, antibiotics, immunization, and they wiped out. And now these lifestyle diseases, a single common factor has been identified. And I'm so unhappy that these findings have not percolated down the line in the community, as our lifestyle expert, Dr. Menon, would tell us. Somehow it has not reached down the community, even in the medical fraternity. A single phenomenon called IR, insulin resistance, brought about by inappropriate, I won't say high carbohydrate intake, leads to most of these diseases. And the new discoveries, especially in these 5 aspects: circadian rhythm, where Dr. Sachin Panda, a biosciences expert in US, he's an Indian, he has shown that for every organ system in the body, there is an on-off mechanism. A time when it functions best, a time when it is in a low key. And that system has to be used, has to be in operation only at such optimum times. For example, the brain, as you know, light and darkness have been right from creation. So the brain, the circadian rhythm, the melatonin hormone, which produces sleep, the levels rise in the evening. So obviously, sleep, the 5th point which I have outlined, is very important. And now doctors have discovered that if sleep is not proper, then all these life-threatening diseases, as I said, I won't use the word lifestyle diseases, get triggered off, especially hypertension, diabetes, etc. And again, the circadian rhythm, for the most important system which impacts our health, the digestive system, clearly shows that the optimal function is in such a way that our eating window, as you would see under the heading of nutrition, has to be only between sunrise to sunset. It has to be between those 8 to 10 hours. not 3 times breakfast, lunch, and dinner. It can be only twice or even once a day, as I practice. Need not be, of course, once a day, OMAD, 1 meal a day, as they call. It may be too much of madness, but twice a day. But the eating window has to be between sunrise to sunset. Otherwise, melatonin levels start rising, and melatonin inhibits the function of insulin, so that insulin is not able to push the glucose into the cells. Hyperglycemia remains, hyperinsulinemia happens, and ultimately it leads to insulin resistance, diabetes. Insulin has a tendency to retain sodium, sodium retention, hypertension, and from diabetes and hypertension come heart disease and stroke. So the importance of circadian rhythm, and again, nutrition, as I mentioned, carbohydrate is something, a food which has to be burnt immediately. Those days, they used to have a rich carbohydrate diet, but they used to go walking into the fields, do a hard work under the sun. They used to get vitamin D also in the process. They used to burn carbohydrate. The storage capacity in our body, the liver glycogen, can only store for 24 hours. Beyond this, the hyperglycemia, as I said, leads to hyperinsulinemia and passive time insulin resistance. And that is why we are stressing that it is not enough if you do HbA1c. You have to do fasting plasma insulin levels, because hyperinsulinemia is the first stage of the whole disease chain, and that leads to, as I said, hyperglycemia, hyperinsulinemia, insulin resistance, and all that. And the importance of a good protein diet, even for adults, up to at least 0.8 grams per kg body weight. And even for vegetarians, as we as SAI devotees, we eat, there are good foods like sprouted moong, batter being made from sprouted moong, and you make dosas with it. The advantage of sprouting is the protein content increases, carb content comes down, and the weight increases. 100 grams of moong dal, if you sprout it, it becomes 225 grams. So your calorific intake can also be reduced by this intelligent approach. And then fats are always condemned, but now we know the role of saturated fats is a big controversy. The American Heart Association still insists it should be only 6% of our total dietary intake, but there's a lot of difference in it. Okay, let us confine to that. But let us remember that we need to ensure that the ratio of omega-3 fats to omega-6 is not more than 1:4. And omega-3, unfortunately, is present only in fish and fish oils. The precursor of it is present in some vegetarian, like flaxseed oil, chia seeds, or walnuts. We need to really have a good awareness about all these aspects. And the most important aspect in this is we should all have ideal body weight. My professor, Dr. Ashwini Kumar, my guru, says 1 inch is equal to 1 kg. So if we are 5 feet 3 inches, 63 inches, 63 kgs. Obesity does not lead to disease. Obesity itself is a disease. And I'm telling you, Swami always says, chasing the chappu, cheppin the chai. He says, whatever you say, you should practice, and whatever you practice should be told to others. So I have been following this dietary modified regimen, not starvation, not fasting, but an intelligent combination of foods. And I have reduced 18 kgs in 1.5 years. All my metabolic parameters, my HbA1c was 5.9 pre-diabetic stage. It is now 5.2. My HSCRP, which again is very important because atherosclerosis is no longer just a mechanical plaque deposition. It is an inflammatory disease, and carbohydrates are found to be inflammatory in nature. My dear friends, it is not only poor oral hygiene, not only chronic periodontal disease, but even inappropriate, I won't say high carbohydrate, inappropriate carbohydrates is a strong inflammatory trigger. In fact, autoimmune disease is also, the trigger is this. And hence, we all need to have ideal body weight. And among vitamins, I need not tell you the importance of vitamin D. It has been associated with so many things like obesity, our immune status, our cardiac health. All of us need to have a screening of vitamin D and to correct the deficiency if it is there. Unless we ourselves have a huge awareness, the next step would be transmitting this message down the line in the community. Whether we are government doctors, SSSI doctors, voluntary doctors, all of us need to talk loud and clear to our patients. We may be neurologists, we may be cardiologists. all of us, if we want to transmit Bhagwan's message of ideal health care, we have to be ambassadors of these new discoveries in the field of, especially as I said, circadian rhythm, nutrition, these life-threatening diseases, and also another phenomenon called autophagy, which is a process by which the body rids itself of unwanted cells or even mitotic cells. This autophagy discovery by a Japanese scientist, he got a Nobel Prize for that way back in 2017. And this autophagy, why I'm telling, gets stimulated, triggered in the night only if there is 8 hours of relative fasting. So we have to finish again, as I said, our eating our eating window. We have to finish our dinner before 7 p.m. Our eating window has to be from sunrise, not immediately after getting up. It's ruled 1 hour time is required for the digestive system to really get into motion from, say, 8 a.m. to 6 p.m. This 10 hours should be our eating window for autophagy to get stimulated. And autophagy has been shown to remove even mitotic cells. And as I said, exercise, physical exercise, circadian rhythm studies show that the musculoskeletal system is most active between 4 p.m. to 5:30 p.m. This is the best time to do exercise, not early morning when in fact everything is agog. The pulse rate, the BP, all if you see are all on the rise. And in fact, myocardial infarcts, as my cardiology friends would tell, are highest during that period. Those who are practicing it can maybe continue it, but the best time has been found to be 4 p.m. to 5:30 p.m. by circadian rhythm experts who have found out. And sleep, I have already mentioned. So what I would conclude is the replication of Swami's message, the replication of Swami's models has to be done at the individual level in the way I had talked about, by being models I devote doctors, by devoting a day at least in every month for free service, and at the community level, our getting associated with Sri Satya Sai Seva organization and having static clinics in the form of specialty clinics. But more importantly, the emphasis of the organization also, our South Indian head of the organization, Mr. Mukundan, is there. I would, with folded hands, request him that this mobile health service, especially in the form of simple uni or bi-specialty, not the big bus, it is so difficult to manage and it is not cost effective also, should be taken up. And doctors, all of us should now stand up, should make ourselves aware of all the modern discoveries, as I said, on important aspects like circadian rhythm, nutrition, role of exercise, role of sleep. First, we should practice. Because I would tell you, in one interview, when one doctor asked Swami, diabetic patients, he said, diabetics ni diet gurinchi chepte వాళ్ళు పాటిస్తలేరు. We advise them so much about diet, but they are not following. Then Swami laughed and said, మీరు డాక్టర్లు దున్నపోతులాగా తింటారు, మీ మాటలు ఎవరు వింటారు? He said, you doctors yourself don't practice. You eat at odd times. You eat unhealthy foods. మీరు ముందు చేస్తేనే వాళ్ళు మీ మాట వింటారు. So let us all practice this, and then we would really become ambassadors of Swami. We would produce the highest patient satisfaction, both in our clinics, in our hospitals, in our medical Satya Sai clinics, in our outreach service. And when once that patient satisfaction is there, the message of Bhagwan in terms of percolation of human values, which Swami was very particular, is very important for societal integrity, societal happiness, individual happiness. Satya Dharma Shanti, Prema and Ahimsa will get transmitted down the line in the community only when we do all these things. I think I have taken a lot of time. I thank you all for your patient hearing, and on behalf of all of us, a prayer at the lotus feet of Bhagwan, that we become instruments, we become ambassadors of Sri Satya Sai ideal healthcare, and thereby transmit his message of human values, which will foster the brotherhood of man and the fatherhood of God. Dear doctors, I thank you all for your patient hearing. Jai Sai Ram. Dear doctors, just a 1-minute clipping on Swami's emphasis on seva, especially, when you take the other sadhanas also. It's not that Swami doesn't say don't do meditation, don't do japa and all, but the emphasis is on seva. As you can see, this beautiful clipping of half a minute.
Natapamsi tapassu valla manaku praptinchadu.
You don't get out of penance.
Natirthanam
No pilgrimage.
na shastrana japanahi
Not sacred text, not chanting his holy name.
samsara sagarottare sajjanam sevanam vina.
To cross this ocean of family life, this
Seva.
service is the only way.
సేవ రెండు పదములతో కూడినటువంటి పదము.
Seva service is a two-lettered one.
కానీ దీని యొక్క అనంత శక్తిని ఎన్ని టన్స్ లో మనం చెప్పలేము.
The infinite power is immeasurable.
దాన్ని కొంట వేయడానికి వీలు కాదు.
You cannot measure it, estimate it.
అలాంటి ప్రేమతత్వాన్ని మనము మొదలుపెట్టి అల్పమైన స్వల్పమైన యొక్క ఈ లౌకిక విషయంలో మనం ప్రవేశించి
You have left that great noblest love and you are adopting the low.
విలువైనటువంటి బలమైనటువంటి మన మానవత్వాన్ని కోల్పోతున్నాం.
We have lost the human life, which is most important.
So, dear doctors, this is the beautiful take-home message of Bhagavan on seva. And as I said, Swami said, seva cheyalante doctor ki minchina profession ledu. This is the beautiful declaration of Bhagavan, which I am sure all of us will imbibe, will take up the teaching of Bhagavan and transmit it down the line in the community by first leading ourselves an ideal life and then doing Swami seva in the way he has told us. Jai Sai Ram.
Sir, Mukundan sir.
Can you proceed with the vote of thanks, Professor Mukundan? Hello.
Sir, లేనట్టున్నారు సార్ మోహన్ సార్.
Okay. I am Dr. Ram Manohar, National Medical Incharge Seva Organization, offering my humble pranams at the divine lotus feet of beloved Bhagwan. We sincerely thank our Bhagwan for having given the permission and also his blessing for this conducting this particular online satsang program. Our thanks are to the speaker, Dr. Narasimhan Garu, the director of the mobile hospital as well as the medical superintendent of the SSSSO-South Hospital, for his lucid talk on various topics in such a nutshell form. To all the doctors, we really sincerely thank you, Dr. Narasimhan Garu, for your sincere effort and your talking from the bottom of your heart with the experience which you already had with Bhagwan, directly getting his directions and circulating and exchanging with all other doctors on this platform. I sincerely thank Professor Mukundan sir, who is the brainchild for this particular Sai Medcell program. He has been toiling day in and day out and trying to bring all the doctors together on this particular platform. Thanks to you, Professor Mukundan sir. I thank all the zonal presidents, the state presidents, and the state medical in charges of the southern zone, as well as all other office bearers of the SSSSO organization at the national level, state level, district level, and Samiti level. Our sincere thanks to all the doctors who have been rendering seva through SSSSO organization in India and all other brothers and sisters in this medical profession, along with the friends who are on board of this platform. Dr. Narasimhan had mentioned about the three-tier implementation of SSI healthcare machine in the state of Andhra Pradesh. I sincerely thank the state president of Andhra Pradesh, Shri Lakshman Rao Garu, the state service coordinator, Sham Garu, and Shri Sai Krishna, the state medical incharge, and praying to Bhagavan to implement this program as quick as possible and being a role model for the entire country. Last but not the least, our thanks to the IT team led by Sai Teja of Anantapur for helping us to conduct this program. Jai Sai Ram. Thank you. Thanks a lot. Sai Ram.
Sai Ram sir. Sai Ram sir. Sai Ram.
Sai Ram sir. Thank you, sir. Sai Ram sir. Thank you very much.
Sai Ram. Sai Ram.
Sai Ram. Sai Ram. Sai Ram sir, it was an excellent lecture by sir. Can you get the recorded links, please?
Sure, sir. We will see. Try to send it to everyone, sir. That was.
Please, sir.
Already it is recorded, sir. We will take the approval from the Ram Manohar sir and Mukundan sir and Dr. Narasimhan sir.